respiratory infection, tuberculosis, diarrhea, HIV, STDs, meningitis, and the rest. No, these are the list of the different or the cases of microbial diseases in Southeast Asia. And as you can see, no, kung mapapansin nyo dito sa listahan, that majority of the microbial diseases that actually infect people are related to respiratory system, no? The blue ones here are actually respiratory infections, and the red ones are actually tuberculosis, which is under respiratory system infection as well. So dito pa lang, no, this is Southeast Asia only, no? Makikita na natin na ang pinaka-common sa lahat ng microbial diseases ay ang pinaka naaapektuhan na system ng katawan natin ng microbial diseases is actually the respiratory system. Okay? Makikita niyo naman sa Pilipinas alone, no, it's more than half, no, more than half of the different microbial diseases ay diseases ng respiratory system. Now, my question is, why do you think, no, ano kaya yung reason? What could be the reason? Bakit pinaka-common ang respiratory infection? Any guess? Bakit kaya? No, isipin mo mabuti, bakit kaya siya ang pinaka-common? Anyone? Yes, Xavier.
Ma'am, kasi omnipresent po ang bacteria or microbes po tulad ng nabanggit niyo po nung nakaraan. Tsaka continuous po ang pag-respire natin, ma'am.
Yes, correct, no? Aside from that, no, anyone, any more answer? Bakit kaya? Bakit kaya, no? Meron pa ba? Wala na, okay. So, bakit ba pinaka-common, no, actually everyday, kahit saan ka magpunta, kahit anong araw, meron at merong respiratory infection. The reason there is we breathe every day. And when we breathe in air. And di ba sabi nga natin, no, that microbes, pathogens are present in the air. Now, if you're going to argue with me, bakit din hindi tayo madalas magkaroon ng digestive infection? Eh, kumakain din naman tayo everyday and alam din naman natin na may bacteria sa food. The answer there is because we cook our food. And when we cook our food, namamatay yung bacteria. And we have digestive juices, no? We have acids in our stomach. Pag kumain ka ng bakterya, mamamatay yon, no? Hindi sila basta-basta nakaka-prosper in our digestive system. Same as true with skin. Bakit din po pag skin exposed naman, 'di ba? Bakit din hindi madalas magkaroon ng infection sa skin? It's because, no, your skin is full of microbiota, 'di ba? Madaming microbes kasi yung skin mo and they fight the pathogen whenever you are exposed to pathogen. Yung hangin, hindi mo naman pwedeng sterilize yung buong hangin. Though, meron na tayong mga technology ngayon wherein they filter the air, no, nalilinisan yung hangin. But when you go outside, di ba, hindi naman may filter yung hangin ng buong Pilipinas. So, that's the reason bakit karamihan, no, sa mga infection, microbial infection, matatagpuan sa respiratory system. Okay, it's impossible, no, for any country to have a filtered, sterilized air. Napaka-imposible yan. Siguro, no, later on, after how many years, baka may makadiscover, but as of the moment, wala pa. Kaya nga, again, no, napakadami ng respiratory infection. Okay? Now, let us learn, no, the different types of microbial diseases in the respiratory system. But before we go on to the different diseases, no, but before we go on to the different infection, I would want to share with you the structure of the respiratory system, no? And of course, let's try to look into the function. Oh, well, you know naman na the function, but this is the anatomy of the respiratory system, no? Your respiratory system is actually divided into two parts. Meron tayong upper respiratory system and we have the lower respiratory system. Upper respiratory system includes the organs located on the head, no? That includes actually your nose, no? Your nasal cavity, the mouth is part of the respiratory system. They're actually connected kasi, and you can breathe in through your mouth. So it's actually an accessory organ of the respiratory system. Aside from that, you also have the pharynx. No, the pharynx is the one that connects your nasal cavity to the lower respiratory system. Okay, the pharynx, it's located on the back of your nasal cavity. And then, no, after your pharynx, pababa tayo, you have the larynx or the voice box, no? Dito nanggagaling yung boses natin, no? Sa voice box. And then, aside from mouth, no, another accessory organ of the respiratory system is your ear. No, kaya nga pag may sipon, affected yung ear kasi connected kasi sila. Okay? Kaya nga if you blow your nose really hard, affected yung ear mo, no? Because they're connected, no? And then the auditory tubes, no? Or yung sa ear din, no? Yung ating canal doon sa ear is part of the upper respiratory system. Now, the upper respiratory system actually contains the microbiota, no? May mga bacteria diyan, no? Good bacteria that actually help the air that we are breathing in, and that actually help in filtering the air that we are breathing in. Okay, so the upper respiratory system is actually covered with a mucous membrane that secretes mucus for extra protection. No, aside from the microbiota, meron tayong extra protection in our respiratory system, the upper respiratory system, which is the mucous membrane. No, they secrete mucus, no? Mucus, yung mga sipon mo, yung mga mucus dyan, no? It will prevent bacteria from attaching to the respiratory system. Okay? Now, when you go down, no? When you go down, dito na natin saan nangyari sa PowerPoint ko? When you go down, no, you'll see the lower respiratory system. Okay? So just below your larynx or the voice box, no, is your trachea. And trachea is already part of the lower respiratory system. Take note, the lower respiratory system is sterile, meaning walang nakatirang kahit anong microorganism dyan. Unless nagkaroon ka ng infection, of course, magkakaroon ng growth ng microorganism. But during the normal days, when you are healthy, no, ang lower respiratory system should be sterile. So your lower respiratory system includes your trachea, or sometimes they call it trachea, no, but I like calling it trachea, but whatever, no, you prefer. We have trachea, we have the bronchial tubes, no, we have the bronchus and the bronchi. Bronchus are actually, ang trachea kasi ito, no, etong windpipe na ito, and then magde-divide yan, no? One in each lang. So, yung main division ng trachea mo is your bronchus, or your bronchi. Okay, and then the bronchi will further subdivide, no, into smaller tube called bronchiole. Okay, so may bronchiole tayo dito, and then on the end of bronchiole, doon sa pinakadulo ng bronchiole are your alveoli. Okay, alveoli are the grape-like structure on the end of your bronchiole. And the alveoli is the site of gas exchange. No, dito nagkakaroon ng gas exchange sa alveoli. Again, remember, lower respiratory system is free of microorganism. Okay? So, sabi dito, there's a ciliary escalator which moves the particle toward the throat via ciliary action. So, yung ating covering, no, yung covering ng ating lower respiratory system is actually ciliated cells, no? The cilia of the ciliated cell will actually help, no, the lungs clear out, no, hina-help niya yung ating respiratory system to clear out the air that's coming in. No, kailangan it's free of any dust, microbe, or any materials. Kailangan gas lang siya. And that is possible because of the cilia of the ciliated cells in the lining of your lower respiratory system. Okay? Aside from that, no, there are what we call alveolar macrophages. No, here in the alveoli, dito sa site of gas exchange, may mga macrophages dyan. No, macrophages are again WBC that fight no pathogen. Okay, so may mga macrophage tayo dyan, and no, there is also respiratory mucus which protects the mucosal surfaces. No, it gives lubrication in the mucosal surface. Okay? So sabi dito, no, the normal microbiota on the upper respiratory system suppress pathogens by competing for nutrients and producing inhibitory substances, no? But the lower respiratory system again is nearly sterile. Okay? Now, let us start our discussion with the different microbial diseases of the upper respiratory system. No, take note, we are talking about the different microbial diseases. So, ibig sabihin, itong mga microbial diseases na ito could be present no, later on doon sa iba't ibang bacterial diseases na ipapresent. Kung may specific bacteria kasi tayo that cause specific disease. So, for example, pneumonia, no? Pneumonia, pag may pneumonia ka, pwedeng magkaroon ka ng mga microbial diseases na ito. Pwedeng magkaroon ka again ng pharyngitis, laryngitis, tonsillitis, and the rest that I will be presenting. Okay? So, tignan muna natin yung iba't ibang klase ng microbial diseases. And let's start with pharyngitis, no? Again, pag nakarinig kayo ng word na tis, that's inflammation. So, ibig sabihin, kung meron kang pharyngitis, you have inflammation of the pharynx or commonly called as sore throat. Okay? So, starting from now, I do not want you to call your sore throat as sore throat. You should be calling it pharyngitis because, of course, you're nursing student. So, later on, pag tinanong kayo, what's the problem? Tapos may sore throat ka. You don't say, I have a sore throat. That's very common. You tell them, I have a pharyngitis. O, di ba? Nagmukha ka pang smart. Di ba? So, that's pharyngitis. No? It's scientific term or more, what's this? More,
I have
more scientific.
pharyngitis.
Oh, sino may pharyngitis? Sino yun? Oh, may pharyngitis siya. So, well, very common
Si Vince
kasi.
po.
Very common kasi ang pharyngitis today because of the weather. Okay, so when you have pharyngitis, you have again inflammation of the pharynx. So if you're going to look, no, bubuksan yung mouth mo, tignan mo sa mirror, makikita mo inflamed talaga yan, magiging malaki siya. And magkaiba ang itsura kasi ang pharyngitis, yeah, it's like this. Ang pharyngitis kasi can either be bacterial ang cause or viral. Kapag viral ang cause, may redness lang, no? May inflammation tsaka redness lang. So, hindi masyadong malala. Kaya nga, kapag may mga pharyngitis, no, you pray na viral lang siya. Kasi pag viral, mawawala siya on its own and mabilis lang. Okay? And ganito lang yung itsura ng viral pharyngitis. But if the cause of your pharyngitis is bacterial, medyo magiging yucky yung itsura ng pharynx mo kasi magkakaroon ka ng petechiae, magkakaroon ka ng hypertrophy, yung tonsillar hypertrophy, no, yung tonsil mo lalaki talaga, no, magkakaroon ka pa ng curd-like plaques in your tongue, tapos may mga nana pa on your pharyngitis. So, bacterial yan pag ganyan. Pero pag ganito lang, it's viral. No, again, viral can just go on, no, pwede silang mawala on their own. But if it's bacterial, you might be needing antibiotic. Okay, so that's pharyngitis. Now, aside from pharyngitis, pwede rin tayo magkaroon ng laryngitis, no? Ang laryngitis naman is the inflammation of the larynx. Okay? Inflammation of the larynx.
Ganyan po yung kay Kuya Jads.
Kay Jads, ano nangyari? Nagkaroon siya ng laryngitis.
Opo.
Oh, so what happened kapag meron kang laryngitis? Since affected ang vocal cords mo, mawawalan ka ng boses or magkakaroon ka ng hoarseness, no? May hoarseness yung voice. Ito yung tinatawag natin sa Pilipino na paos ako. O, 'di ba? Ngayon hindi niyo na din gagamitin ang paos ako. O, di sabihin niyo, I have laryngitis. O, 'di ba? Inflamed ang larynx mo pag ganyan. Hindi normal ang voice mo. Okay? And the most common cause of laryngitis is virus. Okay? So, kung meron kang sipon, tapos meron kang laryngitis, no, wala yung boses mo, automatic you have a viral infection. Huwag kang uminom ng antibiotic kapag ganyan. Okay? So, ayan, no? Though, pwedeng bacterial or fungal yung cause, pero very rare. Majority of laryngitis is actually caused by a virus. Okay? So, this is the normal vocal cords. And ganito yung itsura ng inflamed larynx. Ayan, no? Kaya pangit yung boses kasi naiipit or kapag sobrang inflamed yan, no, wala nang lalabas na boses kasi wala nang space, no, wala nang daanan. Okay, hindi na makaka-vibrate yung vocal cords. Okay? So that is again laryngitis. Okay? And then we have tonsillitis, no? From the word tonsil, no, it's the inflammation naman of your tonsils. Okay? And tonsillitis is actually caused by viral infection. No, most cases are caused by viral infection, such as viruses that cause common cold or flu viruses. So, pag may sipon, no, normally we have tonsillitis, we have laryngitis, may pharyngitis. Kasi nga, ito lahat yung pwedeng maging symptoms, no, maging signs and symptoms kapag meron kang respiratory infection. Okay? So, this is the normal tonsils. Ayan, ganyan siya, no? It's red. Pero kapag meron kang tonsillitis, no, magsuswell, no? Hindi lang yung tonsil actually ang magsuswell. Even the uvula. Uvula yung parang bell. Pag open mo yung mouth mo, di ba? Tapos titignan mo sa loob, parang merong bell sa gitna. You call it the uvula. Okay, so mai-inflame din yung uvula. And then magkakaroon ka ng white spots on the tonsil that look like pus, no? Parang may mga white spots doon. And then of course you'll have a swollen tonsil. And the throat also, no, magkakaroon ng redness and you'll have a gray furry tongue. Pero hindi laging may gray furry tongue ha. Ang madalas talaga pag may tonsillitis, yung inflamed na tonsil, malaking tonsil, may white spot, mga ganyan, tonsillitis yan. Okay? And some cases or most are caused by viral, but some cases are caused by bacterial infection, typically strain of bacteria called group A Streptococcus bacteria. Okay, and then we have sinusitis, no, from the word sinus, no, it's the inflammation of the sinus. Ano ba yung sinus? Sinuses are actually spaces, no, open spaces on the skull. Meron tayo dito sa frontal lobe natin, it's called the frontal sinus. Meron tayo dito sa sphenoid and ethmoid sinus. Ayan. Meron din tayong septum and we have maxillary sinus. These sinuses are just open spaces. Okay? And there are instances, kunyari meron kang respiratory infection, nagkaroon ka ng sipon, there are instances wherein yung mga sinusitis mo will be filled up with mucus, no, will be filled up with sipon. Kaya sumasakit siya, nagiging inflamed siya. No, kaya nga napapansin niyo kapag may sipon kayo, sobrang sakit minsan ng ulo, no, dito part, no, here, this part. Ibig sabihin pag ganyan, baka meron kang sinusitis, baka merong pumuntang sipon dyan sa mga open spaces mo. And for you to get rid of your headache, kailangan ma-clear yung sipon, no, para ma-clear din yung sinuses. Okay? So inflammation of the sinus lining usually is self-limiting. Gagaling yan kapag wala ka ng sipon. Kaya nga pag wala ka ng sipon, 'di ba, hindi na masakit ang ulo mo, pero pag may lalo na pag may stuffy nose ka, 'di ba? If you have stuffy nose, sobrang sakit minsan ng ulo. Ibig sabihin, baka may sinusitis ka. Okay? And it can be caused by virus, bacteria, or fungus that swells and blocks the sinuses. Okay? Now, another microbial disease is epiglottitis. No? It's the inflammation of the epiglottis. Ang epiglottis is this small organ which covers your respiratory tract when you swallow. No, bakit ba kailangan mag-cover? Ganito kasi yung anatomy ng throat natin. 'Di ba? You have here your nasal cavity. Sabi nasal cavity ito, and then you have here your mouth, okay? When you tapos meron kayong dalawang tube kasi dito sa neck ninyo, no? Meron kayong esophagus and meron kayong trachea. The esophagus, daanan ng sinuswallow natin na pagkain. Yung trachea, daanan ng hangin. Okay. Now, when you swallow your food, kailangan ang food pumunta sa esophagus kasi kung pupunta siya sa trachea, it will block the airway. Hindi ka makakahinga, machochoke ka, mamamatay ka. So, para siguradong pumunta sa esophagus yung pagkain na sinalo mo, the epiglottis should close. Okay, so magbababa yung epiglottis na yan, i-close niya ngayon ito. So bababa yan, i-close niya yung trachea para yung food diretso sa esophagus. Now, when you are breathing, no, kapag humihinga naman tayo, yung hangin pumupunta dito sa trachea. Naka-open yung epiglottis natin. Kaya nga, di ba, sinasabi, do not talk when your mouth is full. Kasi, no, nagsasalita ka, kumakain ka, ang tendency, hindi alam ng epiglottis ang gagawin niya, hindi siya mag-close. So, yung food mo baka pumunta sa trachea, baka mamatay ka kasi wala ng airway. Okay? So, you have to be careful. Now, if you have epiglottitis, no, kapag ka-inflame ang epiglottis mo, it is very life-threatening. Why? Kasi baka mag-malfunction siya, no? Baka hindi siya mag-close when you swallow your food. And again, no, you might choke yourself. Okay? Hindi kasi pwedeng kahit may small particle na pumunta sa lung. Kasi even as one rice, no, one rice could block an airway and it might be the cause of your death. Okay? Kaya kailangan well-functioning ang epiglottis mo. Or, no, kahit pa well-functioning yan, if you're doing something when you're eating, pwede kang magkaroon ng, o pwede kang ma-choke. Okay, but epiglottitis is a bacterial infection and yeah, it's a bacterial infection. So most common causes of epiglottitis is bacterial infection. Okay, so those are the different microbial diseases of the upper respiratory system. Now, these microbial diseases could be present no, in any of these bacterial diseases na i-discuss ko. Okay? Let us start with streptococcal pharyngitis. So, streptococcal pharyngitis, automatic, that's a pharyngitis and it's caused by as group A streptococci or commonly called gas. Okay? Ayan, no, sometimes we call it a strep throat and it is caused by Streptococcus pyogenes. Your Streptococcus pyogenes are actually very dangerous type of pathogen because they are resistant to phagocytosis. So, hindi tatalab ang macrophage sa kanila, no? Resistant kasi sila sa phagocytosis, no? They also releases, no, streptokinase which allows clots, and streptolysins are cytotoxic. Okay? So, when you have streptococcal pharyngitis, no, magkakaroon ka ng local inflammation, no, in your pharyngitis. Local inflammation means dito lang sa pharynx mo yung inflammation, okay? You'll have fever, okay? You'll also have tonsillitis and no, the lymph nodes in your neck will also enlarge. Okay? Now, aside from streptococcal pharyngitis, no, pwede kang magkaroon or if the pharyngitis became mag-worsen siya, pwede kang magkaroon ng scarlet fever, no? Bakit? Because, no, erythogenic toxin produced because of the erythogenic toxin produced by lysogenized S pyogenes. Ano ba yung lysogenized Streptococcus pyogenes. Pag sinabi natin lysogenic or lysogenized bacteria or lysogenized S. pyogenes, these are S. pyogenes that are infected by virus. 'Di ba sabi natin, viruses can infect a bacteria. So if the bacteria is infected by a virus, tatawagin natin siyang lysogenized bacterium. And if they are lysogenized already, they have the capability to produce toxin. And pag nag-produce yan ng toxin, it might result to scarlet fever, which is, no, mas malala yung magiging symptoms mo compared to streptococcal pharyngitis. Okay? So, I have here, this is just a picture of tonsillitis. Hindi ko kung bakit siya napunta dito. Supposedly, doon siya sa tonsillitis. But this is how the tonsil look like, no, when you have tonsillitis. Okay? Now, aside from streptococcal pharyngitis, scarlet fever, another bacterial disease of the upper respiratory system is the diphtheria. I don't know if you have heard this already, but diphtheria is a bacterial disease caused by Corynebacterium diphtheriae. It's actually a gram-positive rad. No, it's a pleomorphic gram-positive rad. Pleomorphic means the bacteria can shapeshift, no? Pwede siyang magpalit-palit, no? It can alter its morphology, its status, no? Pwede siyang mag-shift, okay? So, ayan. So, if you have diphtheria or if you are infected by diphtheria, magkakaroon ka ng grayish, no, tough, matigas, no, tough grayish membrane in your throat. It looks like this, no? And this one, this tough grayish membrane na tutubo sa throat mo is actually a result of fibrin and dead tissue because the bacteria will actually interact with the tissues of your throat. And then, pag nagkaroon ng dead tissues, no, magka-calcify siya, magiging ganito siya. And what's scary about this is that, no, kapag sumobra yung membrane, yung tough grayish membrane na yan, ang tendency niyan, baka mag-cause yan ng blockage in the lungs. And of course, when your lungs is blocked, hindi ka makakahinga. Okay? So, the same, no, it is actually produced, no, or it's possible because of the exotoxin produced by lysogenized bacteria. And later on, no, the lysogenized or the exotoxin might actually circulate in the blood, no, yung ni-release ng lysogenized bacteria na exotoxin can actually circulate in the blood. And once na nag-circulate yan sa blood, it might damage other organs like the heart and even kidneys. Okay? Sometimes, diphtheria ay hindi lang sa respiratory system nakikita. Meron din tayong tinatawag na cutaneous diphtheria. It is a diphtheria on the skin. Now, if you have diphtheria on the skin, magkakaroon ka ng skin ulcer. When we say skin ulcer, magkakaroon ng butas yung skin mo. No? Magkakaroon ka ng malaking lesion, magkakaroon ng ulcer yung skin mo. That's cutaneous diphtheria. But for the respiratory diphtheria, ganito yung itsura niya. Okay, so ayan, that's a very, very hard membrane. Now, what's good about diphtheria is that it can be prevented by vaccine. No? Kaya wala na masyadong merong diphtheria ngayon because meron na tayong diphtheria vaccine. And the diphtheria vaccine is what we call the DTaP vaccine. And it's called DTaP because hindi lang siya for diphtheria. It's for diphtheria. DTaP means diphtheria, tetanus, and pertussis. So, ang DTaP vaccine is for prevention of diphtheria, prevention of tetanus, and prevention of pertussis or whooping cough. Okay? And ang DTaP is given sa young children, no? DTaP ay binibigay sa recommended for infants kasi siya, no? It can be given 2, 4, and 6 months. May doses kasi yan. Or pwedeng 15 through 18 months, pwede yung ibigay. Or pwede rin 4 through 6 years. Okay? DTaP. Now, before, DTaP lang yan. But ngayon, meron na tayong booster for DTaP. It's called TDAP. Binaliktad lang. No? TDAP is actually the same, no, but lower doses kasi siya, and it is given sa preteens, no. TDAP means tetanus, diphtheria, and pertussis. So it's a booster shot na binibigay sa preteens. Now, TDAP booster is not just for preteens, pwede rin siya for adults. But aside from Tdap, meron tayong another booster that can be used by adult. It's called the TB. So, tetanus and diphtheria na lang. Kasi, ang pertussis or whooping cough is, ang naaapektuhan lang ay normally bata. So, pag adult na, wala na masyadong whooping cough. Kaya yung booster for DTaP sa adult, pwedeng TD na lang, no? Tetanus and diphtheria. So, ang booster for TD or Tdap, no, for adults, can be given every 10 years. Okay, so you ask your parents, no, kung meron ba kayong DTaP vaccine before. Kung meron, magpa-Tdap booster kayo. Okay, or even your parents, no, pwede silang magpa-Tdap. No, again, the TAP and Tdap are the same. It's just that Tdap have a lower dose, no? Lower dose na siya kasi booster na lang naman siya. Okay, so ayan, no? That's diphtheria and the vaccine for diphtheria. Now, let us talk about otitis media. Otitis media is inflammation of the ear. Pero remember, no, sinali ko ang ear kasi accessory organ siya ng respiratory system. Grabe may ew. Yeah, this is the infection of the middle ear. Ayan. So, ganito itsura ng ear mo if you have otitis media, no? Madaming pus, no? Madaming nana yung ears mo. Okay? So, it's the infection of the middle ear. No? So, infection of the middle ear, ibig sabihin, infection of the eardrum because your eardrum is in your middle ear. Okay? So, it causes formation of pus which puts pressure on the eardrum. So, pag madaming pus, may pressure sa eardrum, sobrang sakit nito. I don't know if you have already experienced this, but this is very common, no? Very common sa mga bata, lalo na yung mga bata na mahilig mag-swimming, ganyan. Madalas nagkakaroon sila ng otitis media. Sobrang sakit daw nito. I remember my sister, when she was young, no, lagi siyang nagkakaroon ng otitis media. Sobrang sakit, umiiyak siya lagi kasi nga may pressure sa air because of the pus formation. But these are the causes of your otitis media. We have streptococcus. What?
Ma'am, si Luis din po, nagkaganyan.
Oo, madalas talaga nagkakaganito, lalo ng mga bata.
Ma'am, si Vince po, ginagamit niya pang ilinis ng tenga, toothbrush.
Ewan ko sa inyo. But anyway, ayan, no, these are the causes of otitis media. We have Streptococcus pneumoniae, 35%, non-encapsulated Haemophilus influenzae, 20 to 30%, no? Moraxella catarrhalis, 10 to 15%. Espiogenes can also be a cause of otitis media, that's 8 to 10%. And Staphylococcus aureus, no, yung nasa skin, 1 to 2%. Okay, again, this is very common in children kasi maliit yung auditory tubes nila. No, maliit yung auditory tubes nila. So, mas mabilis yung pus formation doon. Okay? And this is treated with broad-spectrum penicillins. Okay? So, those are the different bacterial diseases of the upper respiratory system. Now, let's look naman into the viral diseases of the upper respiratory system. And let's start with the most common of all, the common cold. No, lahat tayo, no? Imposible namang may tao na hindi pa nagka-cold ever. Okay? So, bakit ba very common ang colds? The common cold, it's because there are over 200 different viruses that could cause the common cold. And the most common of all these viruses is actually your rhinoviruses, which causes 30 to 50% of the colds, okay? And rhinovirus thrive in temperature lower than body temperature. Now, that's the answer why when we have cold weather, wait.
Ma'am, nawala ka po.
Wait nga, di ba? Ang kulit mo din eh, no?
Tigas na itong gago. Ay.
Yuhu!
Okay, so let's continue. Sorry ha. That's my son. Okay, anyways, so ayun, no? Kaya during cold season, madalas may sipon tayo, no? Madalas may sipon kasi during this time, nagtatrive yung mga viruses that could cause common cold. Okay, kaya nga 'di ba minsan sinasabi ng mga tatanda, pag may sipon dahil yan sa weather. Totoo 'yun, no? Because of the weather. No, kaya madalas may sipon kapag malamig. Okay? Now, aside from rhinoviruses, meron din tayong coronaviruses. Later, I'm gonna talk more about the coronaviruses. But these are the common signs and symptoms of common cold. Of course, we have sneezing, di ba? Nasal secretion, sipon, and sometimes nagkakaroon ng congestion. Okay? And when it worsen, pwede tayong magkaroon ng laryngitis and even otitis media. Di ba nga sabi ko minsan pag may sipon, affected yung ears. Okay? That's because, again, related nga sila. But common cold, no, malalaman mo na virus siya, na common cold siya kapag ka may sipon ka, kapag ka nag-sneeze ka ng sneeze pero wala kang lagnat. No? Kasi pag may lagnat, baka bacterial ang cause niyan. Pero pagka viral ang cause ng sipon mo, wala ka dapat lagnat. And antibiotics are of no use. Kasi nga, antibiotics works with bacteria, not with viruses. So kapag ka may sipon, huwag tayong mag-take ng antibiotic. No, we have to make sure first, siguraduhin mo muna na bacterial ang cause ng sipon mo before ka mag-take ng antibiotic because if it's viral, tapos nag-take ka ng antibiotic, walang kwenta yan. Okay? Walang kwenta ang antibiotic if the cause of your sipon is viral. Okay? So, you can take medication, but to relieve, no? For the relief only of the symptoms, no? Pwede kayong uminom ng cough suppressant or ng antihistamine, pero to kill the virus that caused the cold, wala tayo niyan. Okay, so the best thing for you to do when you have common cold is to improve your immune system. Okay, now that's the viral disease for the upper respiratory system. Now let's move on to the microbial diseases of the lower respiratory system. Kapag ang infection ay for upper respiratory system, hindi masyadong serious, no? Mga ganun lang. Inflammation, konting inflammation, sipon-sipon, ganyan. Hindi masyado. But kapag infected na yung lower respiratory system mo, dito na magiging seryoso yung sakit mo kasi mahihirapan na tayong i-treat yan. Okay? Kasi nga, nasa loob na siya eh. Pumunta na siya sa organs which are supposed to be sterile. So, it's harder for you to treat the lower respiratory system diseases. Okay? So there are different types of microbial diseases, no? Just like our microbial diseases sa upper respiratory system, meron din tayo sa lower respiratory system. Like we have bronchitis, no? Bronchitis is inflammation of the bronchi. Bronchiolitis is the inflammation of the bronchioles, mas maliliit na tubule. No? Later on, magkakaroon kayo ng anaphy, so malalaman nyo later on tong mga to. No? And then you have pneumonia. Pneumonia is a disease for the alveoli, no? Yung site of gas exchange, pneumonia yan. Now, let's talk about the different bacteria. Yes, Vince.
Ma'am, ikaw pa rin ba yung Anafi namin next sem?
I'm not sure. Ay, hindi ko pa alam. Hindi ko pa alam kasi wala pa kaming loading. Let's see. No? But anyway, these are the bacterial diseases of the lower respiratory system. Let's start with pertussis or the whooping cough. A while ago, I've mentioned this already. No? Yun kasali to sa the top vaccine. No? Pertussis or sometimes it's called whooping cough. And it's actually caused by Bordetella pertussis. No? Bordetella pertussis is a gram-negative Coccobacillus. Okay? Now, your Bordetella pertussis, no, is a very it's the cause of pertussis, no, it's cause of pertussis, and this bacteria actually produces a capsule. Okay, now the capsule that your Bordetella pertussis produce allows them to attach themselves in the ciliated cells in the trachea. Remember, sabi natin, yung trachea, no, yung tube that connects the upper respiratory system to the lower respiratory system is covered with ciliated cells. Now, yung ating Bordetella pertussis, no, normally wala naman siyang capsule, but once it enters the body, it actually creates a capsule. Now, the capsule that this bacteria produces will help them attach themselves to the ciliated cells of the trachea. And once na naka-attach sila dyan, no, they will destroy the ciliated cell so that the cilia will shut down, so that the cilia cannot filter the air that's coming through. They look like this. I think I have a picture here. Meron ba? Ganito ang nagiging itsura nila, no? This is the ciliated cell of the trachea. This is the pertussis. So, ang gagawin ng pertussis, mag-a-attach siya dyan. Tapos, pag naka-attach na siya dyan, ipaparalyze niya yung cilia. Once na-paralyze yung cilia, hindi na yan makakagalaw. Hindi na yan ma-filter yung air na pumapasok sa lungs. Okay? So, yun ang ginagawa ng Bordetella pertussis. And once na nakapasok na yung bacteria, then magkukos na yan ng sakit. No, it can damage already the trachea, no, the ciliated cells of the trachea. Okay? Now, pertussis toxin enter the bloodstream. Now, I want to show you the progression of pertussis. Okay? Before long time ago, ang daming namamatay because of pertussis, no? Napakadaming namamatay because of pertussis. Pero recently, nung nagkaroon na ng vaccine, no, wala na masyado. Pero dumadami ulit yung cases, no? Later on, I'm gonna tell you bakit kaya dumadami ulit yung cases. But for now, I want to show you the progression of pertussis, no? Ang pertussis, no, once na nagkaroon ka ng or na-expose ka sa Bordetella pertussis bacteria, papasok yung first stage, no? And that's 1 to 2 weeks, no? 1 to 2 weeks yung longevity ng symptoms ng stage 1 ng pertussis. So, pag na-infect ka, no, 1 to 2 weeks yung itatagal ng symptoms. And these are the symptoms that you will experience during the first 1 to 2 weeks. You experience runny nose, low-grade fever, and occasional cough. So, mukha lang siyang common cold, no? Mukha lang siyang cold lang. Okay? But after 2 weeks at hindi pa gumaling yan, no, nag-continue siya, baka meron ka ng pertussis. So, papasok ka na ng stage 2. So, ang stage 2, no, ang stage 2 will proceed kapag ka hindi mo na-treat yung stage 1 mo ng pertussis. So, at stage 2, it's called the paroxysmal stage, magkakaroon ka na ng numerous rapid coughing fits. No, kasi sa stage 1, occasional cough lang. So, mangilan-nilang, pakonti-konting cough, no? Parang common cold lang siya. Again, if it's left untreated, magpro-progress siya, magiging stage 2. So, magkakaroon ka ng violent coughing, no? Magkakaroon ka ng mahihirapan ko ng huminga, gasping of air, madali ka ng mapagod. Okay? And it will last up to 2 months. And when you experience this, wag nyo nang baliwalain kasi baka pumunta pa ng stage 3. Sa stage 3, we call that the convalescent stage, no? Medyo talagang malala na, hindi na medyo malalang no, hindi naman malala. Sa stage 2 kasi yung pinakamalala. Sa stage 3, bababa na, magre-recover ka na. Okay? Magre-recover ka na dito. But the recovery stage will last up to 1 month. So, magkakaroon ng gradual recovery. Less na yung coughing. Okay? And, pero dito, mas mabilis kang makahawa. Okay? So, stage 3, pababa na yung symptoms mo, pero, no, ang nakakatakot dito, mas nakakahawa siya. Okay? So, kung feeling mo, pagaling ka na, hindi ka na makakahawa, doon pa lang siya makakahawa ng sobra. Okay? So, ganyan, no? Stage 1, no? cold-like symptom. Stage 2, this time you will experience the worst symptoms no ng pertussis, and stage 3, gradual na yung recovery mo but no makakahawa ka ng mabilis sa ibang tao. Okay? Now, let's try to look at this. No, sabi nito before vaccine, 6,000 people died annually in United States alone. Okay? Kaya nga sabi ko, napakadaming namamatay ng pertussis before nagkaroon ng vaccine. But now, dahil meron na tayong DTaP, no, wala na masyadong namamatay. And at the same time, madami na tayong antibiotics that could be used to treat pertussis. Meron na tayong erythromycin or other macrolides antibiotics. Okay? Now, recently, no, merong increase ng cases ng pertussis. Ito kasi, nung 1922, this year, ay makikita nyo ang taas ng cases. Pero nung na-discover ang vaccine, bumaba, no, halos wala. But recently lang, in 2005 to 2019, tumaas yung cases, no? Tumaas ulit yung cases. Bakit kaya? According to studies, these are the reason bakit nagkaroon ng increase ulit in pertussis. Number 1 is the breakdown in herd immunity, no? Dahil feeling ng tao wala kasi wala ng cases, 'di ba? Before 2005. Wala na kasing cases before 2005. So feeling ng tao wala ng pertussis, hindi na sila nagpapa-vaccine. Okay? Dahil na-break yung herd immunity, tumaas ulit. Second, no, another reason daw bakit tumaas yung pertussis is because of the mutation of the organism. Kaya daw kasi, naka-mutate daw kasi yung bacteria that causes pertussis. Kaya, no, kaya niyang mabuhay kahit may DTaP vaccine. Mutated na nga siya. Third reason, dahil daw merong better diagnostic test leading to more reporting, which is, I believe, correct. Kasi before, wala pa masyadong studies on how you can detect or how you can diagnose a disease. Ngayon kasi napakadami ng diagnostic test. So, madali na lang mag-diagnose. So, since na-diagnose na ng mabilis, mas madami ng reported cases. Kasi nga na-diagnose na ng mabilis. Again, that's the third reason daw.
Oh no!
Ma'am,
Okay, I'm back. Sorry, that's so ayun, because of better diagnostic testing. And fourth reason daw, a cellular vaccine having lower long-term immunity. Madami na kasi tayong klase ng bakuna, no? And some of the DTaP vaccine or a cellular vaccine which they believe have lower long-term immunity. Kaya daw mas madaming pertussis cases na naman. Okay? That's why you have to be careful, no? Lalo na if you do not have vaccine for pertussis, baka magkaroon kayo ng pertussis or whooping cough. Okay? Now, there are new strategies for fighting pertussis, no? Ayun, kaya pumasok yung booster natin, no? Meron na tayong booster for teens, adults, and pregnant women. No, dati kasi walang there are no vaccination requirement for. Okay, sorry again for the internet interruption. Anyway, I don't know if you are required to have the TAP vaccine, pero there are some school which requires, require na yung DTaP vaccination for student. I just do not know kung ano yung pinapa-vaccine nyo. Di ba, sometimes some schools kasi magpapa-vaccine. I don't know what's the vaccine, but I hope it's DTaP, no? And then, more government. Okay, so that's pertussis. Ayan no, ang taas na ulit ng cases. Tumataas na ulit yung cases. Okay, so you have to be careful. Okay, now let's move on to tuberculosis. Now, I know you have heard this, and I believe all of you are scared of tuberculosis. Kasi naman, scary naman kasi talaga ang tuberculosis, no? It's actually caused by Mycobacterium tuberculosis. It's actually an acid fast rod, and it's an obligate aerobe. Okay, so 20-hour ang generation time ng Mycobacterium tuberculosis. And the lipids in the cell wall make it resistant to drying and antimicrobial. Okay, kaya nga nakakatakot ang tuberculosis. Mahirap gamutin, no? Mahirap gamutin. Though merong mga antibiotic na ginagamit, kailangan mo mag-take ng antibiotic for so long. For so long kasi nga they are resistant to antibiotic. Okay, maganda nga ngayon kasi may gamot na, before wala eh. Pero yung gamot ngayon ay hindi naman din gano'n ka-effective na agad-agad magagamot, no? It takes time for you to treat a tuberculosis patient, no? But aside from Mycobacterium tuberculosis, meron tayong other causes, like we have Mycobacterium bovis and Mycobacterium avium, no? It's an intracellular complex. No? Pero hindi masyado ito common. Ang pinaka-common talaga ng cause ng tuberculosis natin is the Mycobacterium tuberculosis. Okay? And paano ba nakakahawa? Ang tuberculosis can be transferred from one person to another through droplets. No? Ano ba?
Good, tama.
Oh no.
I'm back again. Sorry about that sa internet namin. So ayan, no, droplets ang transmission ng tuberculosis, no? Pag ang tao na may tuberculosis nag-sneeze or nag-cough, tapos magkatabi kayo, tendency is that ma-inhale mo yung droplets from him. So magkakaroon ka din ng tuberculosis, no? And it's highly communicable. So you have to be careful, no? Lalo na kung alam mo na may history ng TB yung tao, wag muna masyadong malapit, okay? Now, paano nga ba ang pathogenesis ng tuberculosis? It's like this. The bacteria that causes tuberculosis, no, tubercle bacilli. But ang tawag natin dyan, tubercle bacilli, kasi nga madaming causes. Di ba, balik tayo. Meron tayong tatlo. Pwedeng Mycobacterium, tuberculosis, M. bovis, or M. avium. Pwede kasi yan. Kaya ang tawag natin in general sa bacteria that causes tuberculosis is tubercle bacilli. Okay? So, ganito yan, no? Once you inhale a droplet with tubercle bacilli, the droplet obviously will go to your lungs. And then, pag pumunta yan sa lungs mo, aabot yan ng alveoli. Okay? Once na nasa alveoli na yung tubercle bacilli or the pathogen that causes mycobacterium, once na nasa alveoli na yan, since pathogen yan, macrophages will go in that area. Kasi nga, the macrophages will try to kill that pathogen. So, ang gagawin, no, the macrophage will phagocytize it. So, kakainin yan ng macrophage. Now, once na nakain yan ng macrophage, no, the macrophage or the tubercle bacilli inside the macrophage will grow. Okay? So, hindi madadigest ng macrophage yung pathogen. So, pag na-ingest niya yan ng macrophage, the pathogen will grow inside the macrophage. Okay? So, mag-grow yan inside the macrophage. No? Mag-grow yan mag-grow inside the macrophage. Now, the other macrophages will detect na merong ganong nangyayari doon sa area. So, after that, no more macrophage will move in that site. No? Pupunta yung madaming macrophage to try to kill, no, yung nag-grow na bacteria inside that macrophage. Now, no, over time, no, hindi nila kayang patayin yung tubercle bacilli. The macrophage now will release an enzyme, no? Basahin niyo na lang to, sinasummarize ko lang to. The macrophage, no, the macrophage now will release an enzyme and cytokines, no, to try to kill the tubercle bacilli inside. Pero kahit mag-release ng enzyme yung macrophage nyo, hindi nila kayang patayin yung tubercle bacilli or yung pathogen. Okay? Now, kapag nag-release sila ng enzyme, ng cytokines, hindi pa rin mamamatay yung tubercle bacilli, magkakaroon na ng inflammation in the area. Okay? So, after few weeks, no, magkakaroon na inflammation doon. After few weeks, mag-a-appear na yung symptoms, no? Mag-a-appear na yung symptoms doon sa tao because of 'di ba what's this? 'Di ba trinay patayin ng macrophages yung bacilli. Pero hindi nila kayang patayin, 'di ba? So hindi nila kayang patayin, now nagkaroon ng inflammation in the area, no? So nung nagkaroon na ng inflammation doon, no? Nung nagkaroon na ng inflammation doon, nagkaroon na ng symptoms yung tao. Okay? Now, bakit nagkaroon ng inflammation? Nagkaroon ng inflammation because yung mga macrophage that tried to kill the pathogen died. So, nung namatay yung mga macrophages, na-release yung pathogen. Okay? Na-release yung pathogen, doon na nagkaroon ng inflammation, doon na nagkaroon ng infection. Okay? Now, after that, no, magkakaroon ng so may sakit na yung tao during that time, no? So in the area na nagkaroon ng inflammation, magiging ganito siya. Okay? Magkakaroon ng calcified growth or magkakaroon ng calcified bacteria yung mga pathogen dyan, no? Magkakaroon ng magkakaroon ng area na calcified wherein the bacteria will live in that area. Okay? Now, habang nandito etong mga pathogen na ito, no, hindi sila pwedeng mag-regrow kasi mahihirapan sila mag-grow in the area. So magiging latent sila kasi hindi sila makakapag-multiply. So when we say latent, nandyan sila pero hindi sila nagkukos ng sakit. Pero nandyan sila. Pero later on, they will be later on reactivated, no? 'Di ba sabi natin pagka latent, later on magiging reactivated siya. And once na na-reactivate siya or na-arrest yung stage na latent stage, magkakaroon ng lesion yung calcified area. So mabubutas yung calcified area, lalabas ulit yung mga pathogen. Pag lumabas yung pathogen, pwede silang kumalat. And that time, no, magkakaroon ng disease progression. Yun na yung magiging makakaramdam na yung tao ng worst signs and symptoms of tuberculosis. During the early stage kasi, meron lang, no, signs and symptoms na hindi masyadong malala. Maybe coughing lang, mga ganyan. Pero later on, pag na-reactivate na siya at kumalat na yung iba pang mga pathogen all over the body, doon na makaka-experience yung tao ng worst signs and symptoms of TB. Okay? Ito na yung sobrang lalang ubo, yung mga ganyan-ganyan, yung nanghihina na sila, wala na silang energy, no? Yun yung nararamdaman ng mga tao kapag ka na-reactivate yung latent stage ng TB natin. Okay? And this is the diagnosis for tuberculosis, no? Meron tayong tinatawag na tuberculin skin test. Okay? Or ang pag-tuberculin skin test, meron silang ini-inject na purified protein derivative or the PPD, tuberculin. Okay? Pag nag-positive ka sa test na ito, it's either you have the infection or you have a previous infection. Ibig sabihin, kapag ka may previous infection ka, you have a latent stage of TB in your body na later on, pwedeng ma-reactivate. Okay, so after that tuberculin skin test, no, it will be followed by an X-ray or CT exam. Acid fast staining, ginagawa din yan, or culturing bacteria. Okay, now what's the treatment for tuberculosis? Di ba sabi ko, ang tagal ng treatment. Actually, if you have tuberculosis, you have to take antibiotic for 6 months. Okay, you have to be in an antibiotic treatment for 6 months. And paiba-iba yung antibiotic mo, which is very scary din, no? Oo, nawawala yung tuberculosis, but kumusta naman yung normal microbiota mo? 'Di ba? Kumusta naman yung defense ng katawan mo? Kasi if you are into antibiotic for too long, mawawalan ka ng defense, mawawala yung normal microbiota ng katawan mo kasi mamamatay din sila because they are also bacteria. Antibiotic, walang pinipili yan, basta bacteria. Lalo na pag broad spectrum, di ba? But these are the different drugs that are given to tuberculosis patients. No, meron tayong first line drugs, no? And these are the following. Ayan, iba't ibang klase ng antibiotic because again, the bacteria that cause tuberculosis are antibiotic resistant, no? And then we have the second line drugs. Ayan. And then hindi tayo sa first line, second line, no? Meron pa tayong multi-drug resistant, no, strains. Ayan. Pag multi-drug resistant strain, gumagamit siya ng first line. Kapag ka extensively drug resistant, gumagamit siya ng second line. Okay? Ayan. So, there are 9 million developed TB annually and 2 million death dapat to, 2 million death. 2 million death, okay, annually. Okay, kasi nga mahirap siyang gamutin. Napakahirap niyang gamutin. Okay, and 1/3 of the world's population is infected. Sometimes kasi, people who are infected do not show yung serious symptoms. Kasi nga wala, baka maybe nasa latent stage pa sila, kaya ganun, no? Kaya 1/3 of the world's population is infected. And it is the leading cause of death for those with HIV. Now, if you have HIV, tapos nagkaroon ka ng tuberculosis, there is a very big chance na mamamatay ka na kasi immunocompromised ka na dito. Immunocompromised ka na, may TB ka pa, mag-antibiotic ka pa. Wala na, no? Mahihirapan na talaga yung katawan mo dyan. Okay? But meron na tayong BCG vaccine. It's actually a live culture of a virulent M. bovis, no? Mycobacterium bovis, no? Mycobacterium bovis is another causative agent for tuberculosis. Okay, it's not widely used in US due to questionable effectiveness din. Okay, so ayan, no, this is the estimated TB incident rates in 2022. Tignan nyo, no, pag dark green, that indicates there are more than or equal to 500 cases. So kung mapapansin nyo, Pilipinas, dark siya. Napakadami nating TB cases, no? Isa tayo sa may pinakamadami. Ayan. Ayan, no, Philippines, no? In this area, wala masyado. Kasi they are well vaccinated, no? Meron well vaccinated dito kasi sa atin, of course, you know, the situation of the country. Kaya ganyan, no? Kaya ganyan. Ayan, medyo madami tayong cases. And let's see, this one, ayan. Southeast Asia, ang pinakamadami, Southwest Asia, ang pinakamadaming cases ng TB all over the world, no? Pinakakonti actually ang US. Ayan. Okay, so ayan, no? Now, that's TB. Now, let's move on to another common respiratory infection, which is pneumonia. No, bacterial pneumonia. Actually, we have two types of pneumonia. Actually, hindi lang siya two types. Madami tayong klase ng pneumonia, but we have two categories for pneumonia. Meron tayong typical pneumonia and we have atypical pneumonia. If we say typical pneumonia, the causative agents will be your S. pneumonia, S. pneumonia, H. influenzae, and other bacteria. Kapag ka-atypical pneumonia, that's actually Mycoplasma, chlamydia, legionella, and viral causes. Okay? What's the difference of the two? Ang typical pneumonia is detectable on gram stain and they grow on standard media. Now, if you have pneumonia tapos hindi na-detect ng gram stain, that is an atypical pneumonia, no? Typical pneumonia, abrupt onset. Ibig sabihin, mabilis yung onset niya. Pagka-atypical, very slow. Okay, matagal ang onset. If you have typical anemia, you'll experience fever, pleuritic chest pain, no? You have cough, productive of purulent, no, cough productive of purulent. Sometimes, no, blood thinks sputum or shaking chills. Ayan, typical yan. Pero kapag meron kang atypical, no, it will begin as mild URI followed later by mostly dry cough and dyspnea. That's one difference of the two. Pagka typical ang pneumonia mo, ang ubo mo, maplema, no? Madami siyang plema. Kapag atypical naman, very dry. Okay? Ang typical, no, meron kang elevated WBC, meaning malala yung infection mo kasi tumataas yung WBC mo. But if you have atypical pneumonia, milder lang siya. Okay? Slow onset, atypical. Tatandaan nyo, atypical, slow onset, dry cough, and mild. Typical, abrupt onset, tapos meron kang plema, elevated yung WBC mo. Okay? Now, when we say bacterial pneumonia, no? Ang bacterial pneumonia ay pneumonia caused by bacteria. Bacterial pneumonia nga. Meron tayong iba't ibang klase. Depende on what specific part of the lung is infected. Kapag ang infected is the lobe of the lung, we call that the lobar pneumonia kasi ang lungs natin divided into lobes, no? Yung right lung natin, meron siyang 3 lobes. Yung left lung natin, meron siyang 2 lobe. Now, if one lobe is affected, we call that the lobar pneumonia. Kapag ang infected naman are the alveoli, no, we call that the bronchopneumonia. Kapag ang infected is the pleural membrane or the covering of the lung, we call that pleurisy. Okay? Lobar, broncho, pleurisy. So kapag meron kang typical pneumonia, it can either be lobar, broncho, or pleurisy. The same is true with atypical. If you have atypical pneumonia, pwedeng lobar yan, broncho, or pleurisy. Okay? Now, let's try to look into the specific type of pneumonia. So, meron tayo ditong pneumococcal pneumonia. So, pneumococcal pneumonia is a pneumonia caused by S. pneumoniae. So, ibig sabihin, this is typical pneumonia. Okay? So, again, it's caused by S. pneumoniae. S. pneumoniae is gram-positive. It's encapsulated and 90 at 315. Meron siyang 90 serotypes, okay? So, when you have pneumococcal pneumoniae, the infected alveoli of the lung fill with fluids and RBC. So, ang infected dito alveoli. So, ibig sabihin, ang pneumococcal pneumoniae is bronchopneumonia kasi alveoli yung infected, okay? So, since ma-fill up yung alveoli mo ng fluid and RBC, magkakaroon ng interfere with your oxygen uptake. Okay, mahihirapan kang huminga. Kasi nga, punong-puno ng fluid and RBC yung site of gas exchange mo, no? Diagnosis for pneumococcal pneumonia is optosin inhibitor test, bile solubility test, or antigen in urine. Okay, it's treated with macrolides, fluoroquinolones, and it is prevented with conjugated pneumococcal vaccine. Ayan, may vaccine din tayo for this pneumonia. And these are the symptoms, no? Headache, stiff neck, no? Stiff neck din, no? Pwedeng symptoms yan. fever or chills, confusion, no, difficulty breathing, sensitivity to lights, ear pain, cough, chest pain, and sore throat. So, tandaan nyo, if you have cold-like symptoms, tapos dagdagan mo ng stiff neck, dagdagan mo ng confusion, sensitivity to light, ear pain, automatically you have pneumococcal pneumonia. Okay, and again, the treatment are the following. And hindi dapat to binabalewala kasi mahihirapan ka ng huminga. Mahihirapan na yung katawan mo mag-uptake ng oxygen. So, tendency, baka kulangin yung katawan mo ng oxygen. So, it's an emergency event na pag ganyan. Kailangan mo nang pumunta ng ER. Kailangan mo na ng oxygen. Okay, now aside from that, we also have Haemophilus influenzae, another typical pneumonia, no? It's caused by Haemophilus influenzae, a gram-negative Coccobacillus. Excuse me for a while. Okay, so ayan, no? Ang madalas na nagkakaroon ng Haemophilus influenzae are actually kids, no? Mainly mga bata. But aside from bata, may mga predisposing factor tayo, no? Ilan lang yung mga adults na nagkakaroon ng Haemophilus influenzae. Meron or malaki yung chance na magkaroon ka ng Haemophilus influenzae pag adult ka if you are an alcoholic, if you have poor nutrition, if you have cancer, or if you have diabetes. So these are the predisposing factor. But again, Haemophilus influenzae pneumonia, mainly mga bata yung affected. Okay? So symptoms is very similar with the pneumococcal pneumonia. Okay? Ang treatment lang ang different. Kaya kailangan ng proper diagnosis para malaman kung ano talaga yung cause ng pneumonia. Kasi same naman silang pneumonia, magkaiba lang yung cause nila. That's why you have to diagnose it really well, no? Ang diagnosis for this is isolation on special media for nutritional requirement. And ang treatment, you see, magkaiba ng treatment. Ang treatment dito is cephalosporin. So you cannot treat pneumococcal pneumonia with cephalosporin. Okay, you cannot treat Haemophilus influenzae with macrolides or phenoquinolones. No, that's not possible. That's why diagnosis is really important. So I have here, no, the symptoms. Ayan, I presented it the same with the pneumococcal pneumonia. No, Haemophilus influenzae is a type of bacteria that mainly causes illness in babies and children. Kaya nga sabi ko, mostly na affected ng Haemophilus influenzae infection are kids, no? Pwede sa adults, pero with those predisposing factor. Okay, so these are the complications, no? Pwedeng magkaroon ng airway blockage, hearing loss, meningitis, brain damage, and of course, no, worse, spreading death. Okay, so if the bacteria stays in nose and throat, it causes no harm. Pero once na pumasok yan, na pumunta na yan sa lungs, pwede nang mag-cause yan ng Haemophilus influenzae pneumonia. Okay? Now, aside from that, we also have a Mycoplasma pneumonia. Ang Mycoplasma pneumonia is a type of atypical pneumonia or walking pneumonia. Now, this is called walking pneumonia because the symptoms are usually mild, no, very mild, and rarely requires hospitalization. And sometimes people who have Mycoplasma pneumonia actually do not know that they have pneumonia. Okay, and that just go out. Kaya nga tinawag siya na walking pneumonia because some people do not know that they have pneumonia. Okay, and it is caused by Mycoplasma pneumoniae, no? The Mycoplasma pneumoniae, they do not have cell wall. If you have Mycoplasma pneumoniae, no, you have very mild but persistent respiratory symptom. If we say mild, if we say persistent, no, nag-i-stay sa katawan ng medyo matagal, no, mild but persistent. So you'll have low fever, cough, and headache. You see, hindi masyadong malala, no? Hindi ka mahihirapang huminga, walang blockage sa airway. You do not really need hospitalization. But of course, no? But of course, nakakatakot to because pwede kang makahawa, lalo na, no? Hindi mo alam sometimes na meron kang pneumonia. Okay? Sometimes, no, mycoplasma is called the fried egg because they appear like a fried egg in the media. Okay? And they are treated with tetracycline. Okay? So, ayan. Again, it's called walking pneumonia because it's very mild. No? Some people do not know that they have it. But the risk factor for mycoplasma pneumoniae are those who live and work in crowded settings. No? Pwedeng sa school, no? Military barracks, and the likes. Okay? So, these are the complications, no? Kapag ka napabayaan, pwedeng kapag kunyari ang tagal na ng pneumonia mo, hindi mo pa alam, hindi ka pa nagagamot, pwede siyang mag-end into these complications, no? Pwedeng magkaroon ng serious pneumonia, asthma attacks, no? Renal dysfunction, encephalitis, hemolytic anemia, okay? Stevens-Johnson syndrome, or even erythema multiforme. Okay, so it can be spread off by bacteria, by coughing, and sneezing. Okay, now we have another disease here. We have legionellosis. It's also called Legionnaire's disease. Okay, it's caused by Legionella pneumophila. Okay, this type of bacteria actually grow in water and air conditioning units, no? Or pwedeng sa biofilm and pwedeng sa mga fresh water. Okay, so they live mostly in water. Now, how are they being transmitted to human, no? Since sabi ko kanina, they grow in air conditioning units, sometimes, no, people inhale, no, aerosols with Legionella pneumophila. Okay? And once you inhale that, okay, magkakaroon ka ng Legionnaire's disease. Take note, legionellosis is not transmitted from person to person. Magkakaroon ka ng legionellosis if you inhale aerosol with Legionella pneumophila, or no, kapag ka may pumasok na water infected with Legionella hemophilia sa katawan mo. And the treatment for this is erythromycin and macrolides. Kaya nga, no, meron tayong napaka-importante ng mga air filters, no? Kung mapapansin nyo, ang daming air filters na naglabasan ngayon. Meron nga tayong dehumidifier. 'Di ba? May technology tayo, tinatawag natin na dehumidifier, so that, no, the humid in the room ma-eliminate. Kasi sometimes, no, yung humid, yung moisture sa room, pwedeng magkaroon kasi siya ng Legionella bacteria. And once na nagkaroon yung air ng Legionella bacteria, na kung air condition yan, pwede kang magkaroon ng Legionnaire's disease. And these are the symptoms of Legionnaire's disease. Cough, number 1 is cough, no? Basta respiratory yan, halos lahat may cough yan. Shortness of breath, fever, muscle ache, headache. Sometimes, pwedeng mag-cause yan ng diarrhea, nausea, and confusion. Remember, bakit may diarrhea? Remember, Legionella bacteria also occur in fresh water. So, pag nakainom ka ng ng tubig na may Legionella, pwede kang magkaroon ng diarrhea. Okay, so ayan, no, kaya importante din na linisin natin yung mga air conditioning units natin because they might already have Legionella bacteria. Now, aside from air conditioning unit, no, pwede rin, kasi nga nasa water siya, so pwede rin yan sa shower heads, sa hot tubs, no, sa plumbing system, or sa mga decorative fountains. Okay, so mag-ingat-ingat tayo sa mga yan. Make sure that they are really clean. Okay? Now, aside from that, we also have psittacosis, no? Or ornithosis. Ang psittacosis naman is caused by Chlamydophila psittaci. Okay? It is transmitted to humans by elementary bodies from bird droppings transmitted through air. So, eto, no, nakukuha originally ang psittacosis kasi, or the Chlamydophila psittaci, is a bacteria found in aves, sa mga bird. Okay? Now, once na tumai yung bird or di kaya umihi yung bird na nasa taas, tapos na-inhale mo, no, yung air na merong sitasi, Chlamydophila sitasi from the elementary body of the bird, na-inhale mo yan, magkakaroon ka ng psittacosis. Okay? And what will be the signs and symptoms of psittacosis? No, you have fever, headache, chills, and disorientation. Okay? So, yan. No, again, nakukuha natin yan sa elementary bodies from bird droppings. Okay? Diagnosis would be growth of bacteria in eggs or cell culture. Again, treatment is with tetracycline. Okay? And then we have Q fever, no? Q fever is caused by Coxiella burnetii. I think you know this already, no? Meron tayong two types of Q fever. We have acute Q fever and chronic Q fever. If you have acute Q fever, you have high fever, muscle aches, headache, and coughing. Pero if your Q fever is chronic, you'll have endocarditis. Endocarditis is a life-threatening inflammation of the inner lining of the heart's chamber and the valves of the heart. Okay? Nakakatakot yan. Pag nag-inflame yan, pag meron kang endocarditis, it might result to death. Okay? It may occur years after infection. Chronic nga. Okay? And how it is being transmitted, no? Actually, everything will start with a tick bite to an animal. Kunyari, meron kang, let's say for example, a cow. Okay, a cow is being bitten by a tick, na ang tick meron palang Coxiella burnetii. So, kinagat ng tick yung cow. Okay? So, meron na ngayon Coxiella burnetii yung cow. Now, how is this one being transmitted to human, no? So, it is being transmitted to human from the inhalation of aerosol from animals and unpasteurized milk. So, let's say for example, you have a cow na kinagat ng tick na merong Coxiella burnetii, humatching, nag-i-sneeze ba ang cow? Yes, nag-i-sneeze yata ang cow. No, nag-sneeze yung cow. Nag-sneeze yung cow, nandun ka, na-inhale mo yung aerosol from the sneeze of the cow, magkakaroon ka ng Q fever. Or even, let's say for example, may mga milk, nag-collect ka ng milk, no? Tapos, accidentally, na-inhale mo yung aerosol from the milk, magkakaroon ka ng Q fever. Okay, so treated with doxycycline, chloroquine for chronic infection. Naman again, no, these are the signs and symptoms. Pag acute, high fever, muscle ache, headache, and coughing. Pag chronic fever, no, chronic Q fever, it might result to endocarditis, which is very dangerous because it might damage the heart lining. And of course, pag na-damage ang heart, it cannot pump blood, mamamatay tayo. Okay, and then we have melioidosis, no? Melioidosis naman is caused by Burkholderia pseudomallei. Okay, it occurs mostly in Southeast Asia and Northern Australia. Normally, they are found in moist soil. Okay, so commonly, it affects those with lowered immune system. Kaya nga, I always tell you to improve your immune system kasi pag mababa ang immune system mo, I'm telling you, ikaw talaga yung madalas magkakasakit, no? And if you have melioidosis, no, you have magkakaroon ka of course ng pneumonia or tissue abscesses, no? Magkakaroon ng abscesses yung tissue mo. Magkakaroon ka ng necrotizing fasciitis sa different tissues of your body. And of course, severe sepsis. Pag severe sepsis, it's actually the extreme response of the body through infection. It's life-threatening. Okay, life-threatening yan kasi pwedeng maapektuhan yung different organs ng katawan mo. Okay? So, ayan, no, it can trigger chain reaction throughout the body. So, it's very, very dangerous. Okay? So, transmission is by inhalation, puncture wounds, and ingestion. So, again, no, I think I've mentioned this already. Kung meron kayong mga sugat, no, may mga open wound kayo, do not ever try to touch a soil. Okay? Lalo na a moist soil because you do not know what's in there. Okay? Pwede kasing meron yung Burkholderia. Okay? And pag meron pumasok na Burkholderia, baka magkaroon ka ng melioidosis. Again, it's very dangerous because it might result to severe sepsis And, no, ayaw naman nating pumangit, baka magkaroon ka ng tissue abscesses. What if nagkaroon ng abscess yung skin mo? 'Di ba kumalat sa buong katawan, 'di ba? Ayaw naman natin ng gano'n, okay? But it will be treated with ceftazidime, okay? Ayan, no? So this is what's this? Ayan, these are the signs and symptoms: pain, fever, abscess, cough, and chest pain. And again, sepsis. Okay? Now we move to the viral diseases of the lower respiratory system. Madami tayong mga viral diseases for the lower respiratory system. And we start with viral pneumonia. 'Di ba sabi natin, pwedeng may pneumonia, viral, that will be the atypical type of pneumonia kasi viral yung cause niya. So viral pneumonia occurs as a complication of influenza, measles, or chickenpox. No, I don't know if you have heard or experienced it, pero kapag meron kang chickenpox, kapag meron kang measles, pwede kang magkaroon ng viral pneumonia. Pwede yon, no? Pwede yan kasi it's a complication, no? Complication ng measles and chickenpox ang viral pneumonia. Okay? So few labs are equipped to test clinical samples properly for viruses. Now, aside from that, no, meron tayong mga viruses that cause respiratory diseases that might result to viral pneumonia. For example, the SARS-CoV-2 or the coronavirus disease, the COVID-19. Okay, di ba pag may COVID-19 ka, pag malala yung COVID-19 mo, pwede kang magkaroon ng pneumonia. Okay, and SARS-CoV is actually world pandemic 20. I just added this a while ago. But originally, no, I have this. Ayan, madami, pag sinabi kasi natin coronavirus, madaming klase yan, no? Madami tayong klase ng coronavirus. Pero itong SARS-CoV-2, ito yung coronavirus that causes death of millions of people, no? That causes the world pandemic in 2019. But aside from the coronavirus or the COVID-19, meron pa tayong iba't ibang klase ng coronavirus. Like for example, the SARS, no? Yung SARS, ito naman naging epidemic yata in Asia in 2003. Ayan, pero yung mga may SARS noon, malalang SARS, nagkakaroon din sila ng pneumonia. And then meron din tayong MERS-CoV, no? Ito naman sa Middle East, no? Hindi naman siya naging pandemic, no? Pero sa Middle East, ito dati epidemic siya sa Middle East, no? Reported in Saudi Arabia in 2012. So ayan, lahat to are coronavirus. Coronavirus to, iba-iba lang, yung may differences lang sila sa symptoms. Pero kapag malala yan, magkakaroon yan lahat sila ng pneumonia. Pero not everyone ay may pneumonia. Yung medyo may mga mabababang immune system, pwedeng magkaroon sila ng complication na pneumonia. Okay, so that's viral pneumonia. Now, aside from that, we have respiratory syncytial virus or the RSV. This is the most common viral respiratory disease in infants. Okay, almost all children are infected by age 2. Okay, and there are 4,500 deaths annually. RSV, pangbata lang. Ha? Wala kayong RSV, okay? So, ang RSV, pag mayroong RSV yung bata, meron siyang coughing, meron siyang wheezing for more than a week. Okay, but aside from that, no, madami pa siyang symptoms na mararamdaman. Like, imagine, no, a baby experiencing this one. Ang hirap nito. Sore throat, wheezing, no, magkakaroon ng bluish color yung skin niya. Okay? Difficulty breathing, fever, runny nose, and of course, no, nagkakaroon ng infection on the lung. Kaya nga, madaming namamatay na bata kapag may RSV. Pero, hindi lahat ng may RSV na bata, ganito kalala yung symptoms. Okay? Again, depende ulit yan sa immunity ng bata. If the kid ay maganda ng immunity, mild lang yung magiging symptoms. Pero, pag mababa ang immune system ng bata, malala yung magiging signs and symptom ng RSV, no? Diagnosis would be serological test for viruses and antibodies. Ang treatment naman, meron naman tayong treatment, no? We have ribavirin and palivizumab, no? These are antiviral diseases. Okay? And then of course, we have flu. Oh, ayan, eto na yung flu. Madalas din nagkaka-flu tayo, no? Madalas din tayong magka-flu. So, ang flu at ang common cold magkaiba. Ha? Ang common cold, ang flu kasi, balik tayo sa common cold. Kasi baka hindi nyo alam mamaya magrarason kayo, Ma'am, I have a flu, Ma'am, I have a common flu. Ano ba talaga? I have a cold, I have a flu. Baka ganun kayo mamaya, no? Pareho silang viral. The only difference is that pag common cold kasi, upper respiratory system lang, 'di ba? Yung upper respiratory system lang. Kapag ka-flu, lower respiratory system ang affected, meaning mas magiging malala yung signs and symptoms mo kapag ka-flu. Kaya nga there are 30,000 to 50,000 deaths, no, caused by flu annually in United States alone. Okay, and we have different strains of flu. Meron tayong flu, avian flu, swine flu, and mammalian strain, no? Swine serves as a mixing vessels for new strain. So yung swine flu, no, pwede yan mahaluan ng ibang strain para magkaroon ng bagong strain. Okay? Pero ang most common dyan is the mammalian strain. Now, if you have flu, if you have influenza, you'll experience this type of symptoms: fever, nasal congestion, persistent cough, chills, no? Chills, wala tayong chills sa common cold. Headache, okay? Aching muscle, okay? Wala tayong aching muscle sa common cold. Fatigue, no? Nausea and vomiting. Wala din tayo niyan sa common cold. Both viral infection. No? Both viral infection. Again, common cold, milder lang kasi upper respiratory system. Influenza, medyo mas serious kasi lower. And ito yung tinatawag natin na trangkaso. Yes, Kyla?
Ma'am, tatanungin ko lang po sana kung ano po yung trangkaso. Kakasabi mo lang po. Thank you po.
Ayun, yeah. Ito yung trangkaso. 'Di ba pag may trangkaso ka, may fever ka, giniginaw ka, may ubo ka, may sipon ka, masakit ang katawan mo. 'Di ba lahat 'yan may experience mo. That's the flu. Okay? So, kapag sipon lang, ubo lang, do not say na I have a flu. No, hindi ganoon ang flu. Ang flu, sasakit ang katawan mo. Magkakaroon ka ng fatigue, aching muscle, and all. Okay? So, 1% mortality, usually the very young and very old. So, wag niyong baliwalain ang trangkaso, no, ang flu, because there are reported cases, mortality cases. Though 1% lang yan, pero still you have to be careful. Okay? And your influenza, meron tayong vaccine for that, no? We have a multivalent vaccine for the most important strains lang. Yung mga mammalian, swine strain, ganyan. Okay? But for the strains that are not usually, na hindi common, no, we do not have vaccine for them. Okay? So the composition of the vaccine is actually determined annually by the identification of circulating viruses. Okay? So hindi pare-pareho. It depends on what type of strain it is. Okay? So a flu is actually hard to diagnose because we do not have a diagnostic testing specifically for flu. Malalaman mo lang na it's a flu if you experience those signs and symptoms, no, those common signs and symptoms. And treatment, we have here, no, pero meron naman tayong bioflu. But the bioflu, take note ha, the bioflu that we are taking kapag meron tayong flu ay hindi to kill the virus. Okay, it's not to kill the virus, it's just used to lessen the symptom. Okay, hindi siya talaga, ay inom ako ng bioflu para mamatay yung virus that causes my flu. No, it's not like that. Okay, kasi if you really wanted to kill the virus that causes your flu, you have to take this medication. Bioflu is to alleviate the symptoms only. Okay, so we have Relenza, a common name, and Tamiflu, a common name. Let's not read the generic name because it's hard. Hindi naman tayo pharmacist, di ba? But anyway, ayan, no, yan yung common name ng mga gamot for flu. I don't know if we have that in the I haven't heard kasi pag may trangkaso ako, bio-flu lang naman ako. No, but what good thing about flu virus is that they are um self-limiting, no? Kahit hindi ka uminom ng Relenza, Tamiflu, mamamatay sila over time. No, yun naman ang maganda sa kanila. No, again ha, ang bio-flu gagamitin mo lang if you have flu infection. Daw pwede mong gamitin yan pag may common cold ka kasi it alleviates nga the symptoms. Okay? Pero yon, gamitin mo yan kapag you have flu or common cold. Pero again, hindi niya pinapatay yan ang virus. Okay? Now, we're almost done. Let's move on to the fungal diseases of the lower respiratory system. Wag kayo pala magano ha, antibiotic pag may flu kayo kasi viral 'yan. No, hindi epekto ang antibiotic. Okay, so ayan, may fungal diseases din tayo for the respiratory system. Okay, so number 1, we have the histoplasmosis. It's caused by Histoplasma capsulatum. It's actually a fungi, no? It's actually in a yeast form which grows intracellularly in macrophages, no? Meaning what's this, meaning they grow, no, they multiply, they reproduce inside the macrophage. Okay, and they form lung lesions. Okay, if you ingest them, they can form lung lesions, and there are 0.1% of cases that become severe. Okay, magiging generalized disease siya. Ibig sabihin, buong katawan will be affected. Okay, it can be acquired from airborne conidia in areas with bird or butt droppings. Ayan, no? And treatment? Ayan, these are the treatment. Itraconazole, amphotericin B. Ayan, histoplasmosis. Ayan, nakukuha yan sa mga bird droppings, no? Or butt droppings. Tapos, na-ingest mo sila, magkakaroon ka ng histoplasmosis. So, signs and symptoms, magkakaroon ka ng, wala bang signs and symptoms dito? Yun, na meron tayong lung lesions, no? Magkakaroon ka ng lung lesions. But you'll have fever, cough, chills, headache, and then later on, if left untreated, pwedeng mag-result yan into lung lesions. Okay? And then we have coccidioidomycosis, no? Also known as valley fever or San Joaquin fever. It's caused by Coccidiosis immitis, no? It's a fungi also. It can be found in the desert soils of American Southwest. Ayan, wala naman tayo dyan. So, anyway, it's still good that you know this. Kasi later on, baka mag-America kayo, no? Baka ma-encounter niyo siya. It's actually a form, no? Spheral filled with endospores in tissues. So, most infections are not apparent, no? You'll have fever, cough, weight loss. And less than 1% of cases resemble tuberculosis. Treatment, no? The same with histoplasmosis. Ayan, what is valley fever? It's disease of the lungs. It's common in the western US, caused by fungus in soil, and it occurs when people, animal inhale airborne spores disturbed by wind, farming, and construction. Nakukuha naman sa animals. So take note, no? Yung histoplasmosis and valley fever, pareho na manggagaling sa animals yung bacteria. Sa histoplasmosis, manggagaling yan sa bird and bats. Dito naman, manggagaling yan sa wild and domesticated animals, no? Though susceptible sila, pero manggagaling talaga dyan, no? Symptoms will arise 1 to 3 weeks following exposure, and 60% of people infected, they don't know that they have it. Okay, so these are the symptoms, no? Same, parang kamukha nung flu and pneumonia ang symptoms niya. Merong coughing, weight loss, difficulty breathing, no, skin lesions, chest pain, fatigue. Ayan, that's valley fever. And ganito siya, no? Ganito yung, what's this? A life cycle ng a fungi that causes valley fever. 'Di ba sabi natin galing siya sa soil, no? Galing siya sa soil. Nakikita siya sa soil sa America. So, yung fungi sa soil, no, it will start with a hypha, and then later on the hypha of course will start to grow, tas magse-segment siya. Okay? So, magseseparate yung hypha and then hanggang maging maliliit siya and then magiging airborne na siya. So, mahahalo na siya sa air and then pag nahalo siya sa air, people can actually inhale. Wait lang, excuse. Okay. So, ayun, no, pagka nahalo siya sa air, no, people might inhale it and then later on, papasok siya inside the body. Okay? Pag na-inhale mo yan, it will begin to enlarge, no, lalaki siya ng lalaki hanggang maging endospore siya, hanggang malaki na siya, maging malaki na siya. And this time, pwede na siyang mag-cause ng mga signs and symptoms na na-experience ng may valley fever. And then, no, pag lumaki siya ng lumaki, nag-mature siya ng mag-mature, pwede na later on yung human ang maging cause ng spread ng disease na ito. Okay? Excuse me.
Oh man!
I'm sorry for that. I still have cough and medyo nagmamadali ako kasi my daughter have coding education so I have to bring her to school at 3:15. Anyway, patapos naman na tayo. I have 4 slides more. So let's finish this, no? And then lastly, we have pneumocystis pneumonia. It's caused by pneumocystis jirovecii, no? Jirovecii. Sometimes they call it jirovecii. But anyway, bahala kayo kung anong gusto nyong pag-pronounce. Actually, no, this pathogen is not known. Hindi alam if it's a protozoa or fungi. Okay, wala pang current study of what really anong type siya ng microorganism talaga, whether it's protozoan or fungi. And if you have this, no, you'll have asymptomatic siya, no? Asymptomatic siya in the immunocompetent people. So if you have a very good immune system, magiging asymptomatic. So you will not experience any symptoms at all. But later on, no, kapag immunocompromised yung person, pwede siyang mag-cause ng pneumonia. Okay, and it's actually a primary indicator of AIDS as well. Okay, they are found in the lining of the alveoli. They form cyst, and the cyst rupture, releasing 8 trophocytes. Okay, ganito. If you ingest them, ganito, no? Mature kasi na cyst contains 8 in 8 what's this? Trophocytes, okay? Now, pag nag-rupture yan, no, lalabas yung mga trophocyte, no? Lalabas yung trophocyte and then eventually each trophocyte will grow on their own. So, mag-grow yan ng mag-grow until what? You're going na? Wait, just for what? 2 minutes.
Papa, there's the one go around you.
Yeah, I'll come. Wait, 2 minutes only, okay?
Okay.
Okay, so yung trophocyte mag-grow, no? Each trophocyte will grow until eventually magmamature sila, nagmamature. Pag nagmature sila, magde-divide sila, no? Magde-divide sila and then each, no, trophocyte na nag-divide, magde-develop into a mature cyst containing 8 intracystic body inside. So, ganun sila kabilis dumami. Kaya, no, kapag meron kang ganito at immunocompromised ka, no, magkakaroon ka ng symptoms. Pero again, if immunocompetent, no, hindi ka naman magkakaroon ng symptom. Okay? And lastly, we have the North American blastomycosis. It's caused by blastomyces dermatitis, no? It's fungi, again, no, dimorphic fungi, and they grow in soil. Okay? Symptoms resemble bacterial pneumoniae, cutaneous abscesses, and extensive tissue damage. So, the same with bacterial pneumonia, yung kanyang symptoms. Plus, you add cutaneous abscesses and extensive tissue damage. So, there are reported 30 to 60 deaths annually. No, konti lang naman, pero of course, still dangerous kasi hindi mo alam kung saang soil mo siya makikita. No? So, it's treated with amphotericin B, and yun, no, I have here this one. So, fungus in moist soil. Again, do not touch moist soil, lalo na if may sugat kayo. Like kung sinasabi sa inyo yan, no, do not touch moist soil. Even dry soil yan, no. Nakakatakot pa rin, pero mas nakakatakot yung moist soil kasi nga mas mas mabilis mag-grow yung bacteria doon. So do not touch moist soil, especially if you have an open wound. Okay? So infected individuals will have they will have symptoms like bacterial pneumonia. And for those patients with organ transplant, HIV, no, diabetes mellitus, no, mas magiging malala yung symptoms sa kanila. Okay? So that's it, no? There are also organs involved. If you have blastomycosis, you have your lungs. So pag nag-worsen siya, if you left it untreated, no, pwedeng ma-involve yung lungs mo, of course, no, yung brain, yung skin, and even the bones. Okay, so that's it. No, I'm sorry, medyo nagmamadali ako because I have to bring my daughter to school because of her coding education. Questions? Questions, guys? Wala ba?
Wala,
So if
ma'am.
you okay,
Wala
so if you
pa.
don't have questions, we will leave then the meeting and then I will meet you on Friday for our lab. Okay, and then I'll meet you again on Wednesday for the last lecture. Okay, so goodbye everyone. See you
Bye,
on
ma'am.
Friday.
Thank you, ma'am.
Bye po.
Bye, ma'am. Thank you,
po.
Bye, ma'am.
Bye, ma'am. Bye, classmates. See you later.
Talaga to.